Let's leave the politics of it out of it for the moment. I mean, a lot of people argue about how he did it, how the Democrats did it was not the right way to do it. Let's talk about the substance of it today. What do you like about it? What don't you like about it?
Well, what I like about it is that there are things in it that try to promote the idea of quality and actually getting healthcare organizations, physicians, and otherwise really focusing on quality and the delivery of care and recognizing that quality and so forth. You know, what I clearly don't like about it is that what it is going to do is explode the Medicaid population. That is going to be a burden to the state that we are not going to be able to sustain, frankly. And so I think that has
not in this state, not in any state.
Exactly, exactly. And we've heard that over and over. And you can argue about what the number is over a 10-year period of time, but it is a lot of money. And it is a lot of money that's going to come out of other places like education and public safety and infrastructure and so forth in order to keep up with what is going to be a massive entitlement. And so that is what I have a huge problem with. And I don't think that that is going to contribute to reining in the skyrocketing cost of care.
You're also unhappy with the individual mandate, the so-called individual mandate, which at least as of now by this judge in Florida, this court in Florida, has been declared unconstitutional. You're not happy with the individual mandate component of that either.
Right, I'm not at all, and again, I understand that that is something, in order to get what they want out of this bill, right, you have to have that in there. Yeah. But I just think that philosophically, I'm opposed to that being imposed on us as a citizen of this country.
Ms. Dunkelberg, you smile when I mentioned the individual mandate being unconstitutional.
Well, I smile because, as you know, there have been four federal judges who ruled.
It's 2 and 2,
two
right?
have held
right.
it up, and 2 have struck it
We're all
down.
captives of the last conversation.
It's not a
though,
matter
right?
of scoring on this. The Supreme Court will decide.
Yeah,
so,
right.
And probably not until 2012.
Are you optimistic about the Supreme Court finding this to be constitutional?
I don't think. No, I don't think I have standing to make a judgment about that. I think the one thing we all have to know is that we won't know until they decide, and that probably won't be till 2012.
You disagree with Dr. Zerwas about the notion that one of the big problems with the Obama healthcare reform is that it explodes the number of people who are in the Medicaid system, and therefore explodes the cost to us and the burden on us?
I do. I'll be bold enough to say that, but I will, and I'm sure you're all shocked, but I'm going to step back and say the reasons that what I do like about the law, when I have gone out and done like 40 training sessions around the state, and I must say, we refuse to do these unless people will give us 90 minutes. So it's really hard to encapsulate anything. Yeah. But one of the things I say is, everything about this new law is flawed. Congress is not capable of passing laws that aren't flawed. That's the way our system works because there were a million compromises involved. But this is the first time our country has ever tried to establish a system where at least everyone lawfully present has a guaranteed access to a decent standard of care no matter what their income is. Right. It's a major change in the way the insurance market works to where you can no longer be profitable by avoiding risk. You have to be profitable by managing risk and attracting customer service. And the Medicaid, the individual mandate piece, to the best of my understanding, is basically something the insurance industry wanted, because if they're going to move to a model where they can turn no one down and can't charge anyone more based on their health care status or history, then they want all the healthy people in the pool too, or else the pool will be unavoidable. So nobody put an individual mandate in there because they thought it was the right thing to do. It was just a practical
Well, in fact,
matter.
one criticism of the Obama healthcare reform bill from the left was that it basically was like an economic development
for the
effort
health
for the health
insurance
insurance industry.
If you look at the projections for the Affordable Care Act, the vast majority of Americans, the number of Americans continuing to get their coverage through employer-sponsored coverage from commercial insurers is almost unchanged. You're just adding a Medicaid expansion, and you're adding a new exchange where private coverage and public subsidies come together.